everyone. This is Kyle with Physical Therapy. Hope everyone is safe and keeping their sanity at home. We're here today to talk a little bit about balance. And when we think about balance in the human body, that's simply our ability to stay centered within our base of support, whether that's standing on our feet, sitting in a chair, or even down on our hands and knees. Our body has a very sophisticated process by which we gather information through our limbs, our eyes, and our inner ears, providing a lot of information up to the brain and the brainstem. And our body makes good use of that information and then is able to project out more information on how to move and respond to keep ourselves centered and aligned. So when we're either assessing balance or when we're training balance, we do take into consideration there's lots of different pieces of the puzzle, so we can make this as basic or complicated as necessary. For our conversation today, we'll keep things very easy for little things that you can do at home right now in the short term to keep yourself balanced and active. Overall, the idea is to move more and sit less. And so we're trying to always recommend first and foremost following the big guidelines for exercise. And I explain to a lot of my patients that I'm looking for 5 days a week of walking, and we just do the best we can based on your individual circumstances. But for an ideal active adult, we're looking for walking at least 30 minutes a day, 5 days a week, especially if that's the only thing that we have access to right now. And then for some of my most active people, we're pushing that up maybe towards an hour a day of walking. And walking is one of the most fundamental human movement patterns. It is great for the spine. It automatically builds in an element of balance. And for some of us, we will walk unsupported. If you're used to using a cane, walker, or rollator, those are all great strategies where you want to take them with you to be safe. So first recommendation for balance, let's get walking even a little more. I love seeing everybody outside, obviously wearing their masks and 6 feet apart. But it's great to be outside, to get walking and moving to work on your balance. What we're going to review here today is just a basic sequence of what you can do in addition to being active that's a little bit more balance oriented. The way we're going to set this up is in front of the kitchen counter or something equivalent just for a little bit of extra safety, and ideally with the chair behind us. We'll be standing in front, so you'll always have a little bit of extra support. Safety net behind you, because we always want to be aware of our surroundings and then trying to minimize any risk where we don't want to have any falls while trying to obviously improve our balance to prevent falls in the first place. So what we're going to start with is a very easy progression. We're going to stay still in the beginning, which is the easiest, and we'll work our way to a slightly more difficult level each time. And it takes a little bit of self-awareness to know whether something is challenging enough or too challenging. So I ask all of you to please be careful if you're going to practice a few of these. And then obviously stopping at the level that is difficult enough for you but still safe. Okay? The first one we're going to do together is we're going to stand in front of the counter. The feet are going to be straight ahead, about shoulder to hip width apart. And we're just going to see how well we can hold our balance statically in a normal position. This should feel pretty easy for most of us, but this is where we start. We want to use the hands very lightly so the body is doing most of the work. This is just there for a little support. Always keep at least the fingertips on the counter just to stay steady. We're going to hold that for 20 seconds at a time, and we can repeat that 3 times. Okay, so all of our static holds will be 20 seconds, 3 repetitions. After our feet at normal stance, we're going to bring them close together. Ideally all the way together if possible. The smaller base of support will make things a little bit more challenging. Hands stay on the counter, and we're just going to hold that, noticing that there may be a little bit more sway, and that little bit of movement back and forth is normal reactions for the body, so that is okay. We're going to hold this one for 20 seconds as well, repeating 3 times. And if that's too much, it is okay to do 5, 10 seconds, whatever you can do right now safely is good enough. We wanted to get in the habit of doing these little things daily is more important than trying to do too much at once. And then our final static position will be 1 foot a little more in front of the other, staggered. This one will be the hardest one yet, so you should notice a little bit more wobble, that's okay. Same thing, 20 seconds. And then additionally, flipping the feet and performing that with the other foot in front. Fingertips on the counter, holding for 20 seconds if possible, 3 times. And those will be our 3 of starting static, building up a little bit more difficult. For those of you that still find that quite easy, we're now going to start to add in a little bit of movement, but starting on 2 legs and not 1 yet. The first one we have moving, we'll go up and down on the toes, working our balance, and we're getting a little bit of extra benefit of strengthening the calf muscle at the same time. We'll try to do anywhere between 8 or 12 in a row. Obviously, you do what you can right now, and repeating that 3 times. Our next movement-based balance task will be doing a little bit of shifting side to side. You get a chance to test your left leg a little bit, and same thing, testing the right leg back and forth. Noticing whether you feel confident more so in one leg or the other, because that'll be good information for later. Only swaying as far as you can control safely. We'll do 20 total, 10 each way. Take a little break, and repeating that 3 times again. And I think for a lot of us that'll likely be challenging enough, but for those of our individuals that still find that pretty easy and doable, our next step is actually to then progress onto 1 leg. And for our balance purposes, we're normally assessing someone's ability to hold their single leg balance for no more than 10 seconds. So a little bit goes a long way. We don't want to hold this for too long. So we'll practice working towards 10 seconds at the most, and then performing that 3 times on each leg. And what we're looking at here, nice tall posture, minimal movement, maybe a little bit more hand support is okay. 10 seconds on 1 leg, regathering ourselves, and then 10 seconds on the other side. 3 times each leg. And obviously, if either leg felt very uncomfortable, painful, or really unstable during the weight shifting, that's a good sign that we shouldn't be then standing on 1 leg for any amount of time. So that's where I do want you to pay attention to what you feel is how we go. And then our final step for today, to make things even a little more advanced, we're going to go with still the 1 leg at a time, and then we're actually going to add in kicks with the other leg. This will work nicely into balance and stability on the standing leg, and then eventually we'd be able to add in either bands or weights onto the kicking leg, which is rolling us into both balance and strengthening at the same time. So we're really getting multiple benefits at once. For today at home, let's just go with body weight to start. Same thing, up on 1 leg, nice and steady, nice and straight. These kicks are small, they are intentional, and they are smooth. Moving a little slower will build more tension, which is good for our balance and for our muscles. We'll do 8 to 12 kicks forwards, 8 to 12 kicks sideways, and also 8 to 12 kicks backwards. And just be mindful of the fact the chair is behind you just close enough. You can take breaks between each of these, or if you're feeling pretty steady, go ahead and try to go through 1 set of both the forwards, the sideways, backwards, then take a rest. And doing the same thing, 8 to 12 slow kicks forwards on the other side, then sideways, and then backwards. And each of those is a good practice to go through. I would always recommend starting with the basics first, because we always want to get the basics down packed, so it's a good warm-up if you follow through that whole sequence. And then obviously for those of you that are having any big difficulties or medical trouble that prevents you from getting up and walking and exercising, I'd always recommend that's a good reason to be here with us in physical therapy. We'll be able to give you a strong assessment, figure out what your individual needs are, and figure out a program customized that'll obviously take into account where you are now and where you would like to be. We will likely be starting up a little more therapy for our apartments in a few weeks, so I'm asking everybody to hang in there unless you've got a really urgent position as we're kind of working through this virus together. And then obviously as we move forward at the other end, if I have some people here that are very advanced that feel like they don't get much out of balance training, a lot of this might be too easy for some of our most advanced clients. that's another great reason actually to come meet with us in physical therapy a little bit, because we can also provide some customized advanced programs that can be more challenging and that would actually seamlessly work well with Kayla and Amanda's program downstairs. So I would encourage everyone, both at the extremes of a lot of difficulty and then maybe just not finding enough challenge in the exercise, once this is all simmers down, to actually come see us and we can get you started on exercise again. But I hope this helps. I think this should give you enough to stay busy for a little while at home. Remembering first and foremost, we want to get more active, sitting less. So walking is encouraged with the mask and the 6 feet of distance. And try these little things at home. I would say a couple days a week would be great, but it should not be much of a time commitment. We're trying to build good, healthy habits, so you're thinking about how can I move a little bit more every single day rather than trying to do too much at once. Thanks, and we'll see you guys all soon.